Hi, my name is Rebecca Ornelas. Today I will be going over a few questions regarding establishing great relationships with patients and staff members, and also ethical issues regarding patients' rights. Today I will be interviewing Ms. Ortiz. Ms. Ortiz, do you feel that it is important to establish a great relationships with your patients, and why?
As a nurse practitioner, I feel that it is very important to establish good relationships with our patients because our patients come to us regarding their health or any health concerns that they may have. In order for a patient to feel comfortable, it is my duty to make an effort to create a good and positive relationship with my patient. The overall goal when seeing my patient is for them to feel comfortable and for them to come with me with any concerns that they may have regarding their health care. It is important that each patient is open to their provider, so therefore I have to build a strong, good relationship. I want to ensure that the patient feels comfortable around me and that the patient feels comfortable sharing with me their health needs and any concerns that they may have regarding healthcare. I feel that it is important for patients and their family and caregivers to feel comfortable when I am assessing their healthcare needs.
Okay, could you inform me how you establish relationships with your patients?
I work for a pediatric clinic, so for me it is very important to establish relationships not only with my patients but as their parents or caregivers as well. The first thing that I do is children are always scared to go to the doctor. A lot of the times they're told that they're going to get shots, or a lot of the times they're just simply scared because they think that something bad is going to happen. So the first thing that I always ensure is that I make my patient feel comfortable. I always try to ask how's school going, or try to make the patient laugh, or if it's a baby, just try to talk to them so that they won't be so scared of seeing me. Another thing is I like to introduce myself to parents if they are not, if they have never met me before. I like to tell them a little bit what I do and what I want to achieve when seeing the patient. I always ask the patient what's going on with them. If they're too small to understand, I always go to the parent. Once the patient or the parent tells me the concern that he or she may be having, I ensure to assess the patient. Once I assess the patient, then I make the parent feel as comfortable as possible. I always try to ask the parents questions as well as the patients, so I can ensure that their symptoms add up to what the patient is saying. It could be difficult when working in pediatrics because a lot of the times children cannot address the situation like an adult would. They do not quite understand where the pain is coming from or what the issue may be. So it is a bit more difficult, but I like to make the patient and the parent feel as comfortable. I like to show loving and careless and comfortness to the patient because I want the patient to feel comfortable when they are around me.
Okay. Are you ever faced with barriers when you try to establish relationships with your patients? What would those barriers be?
A lot of the barriers that I think I have a lot is that a lot of the patients are Spanish speaking. I am bilingual and I do know a lot of Spanish, but there are some words that I do come across that can be quite difficult. And of course, living in the valley, I have kind of just established my own words or kind of just go with what I was taught or may hear around me. So I think a lot of the times I may sound funny when I cannot say a word, but I usually, refer to my English-Spanish dictionary and then I will go over it with the patient. Another barrier that I face is that a lot of the times our cultures may be different. Many parents may not believe in certain things that I may be trying to explain to them. So it is difficult because sometimes we don't meet eye to eye, but I try to do the best that I can to overcome these barriers to make the patient and their parent feel as comfortable as possible when assessing the patient.
Okay. Do you feel that it is important for a provider and other staff to establish a great relationships with one another? Why does this affect the patient?
Yes, I do think it is very important that all healthcare professionals in the facility get along with one another and have a good relationship. I have dealt with issues in the past that, maybe a nurse assistant or somebody may not quite agree on the way the patient does things, or they have their own points of views, or they may just not simply agree on certain situations. I think that the best thing for the patient is for all staff to get along. I would not want the patient to walk into our office and feel the tension between staff members. I have felt that before. It is awkward going into a facility where you can feel the tension between two staff members that don't quite get along, or they may give each other attitude. This affects the patient because the patient may not feel comfortable, and he or she may feel unwanted or uncared for because of these issues that have come about between staff members. A lot of the times too is sometimes staff members may get into an altercation that will involve mispractice to our patient, or miss something because of this disagreement between the staff members. It is important to have a good culture and a good work environment to make our patients feel welcome and to make our patients feel wanted.
Okay, what are some of the barriers you face when trying to establish working relationships with staff?
That is a big one. A lot of the times we're faced with many people, don't like one another, or they don't want to work with each other. This could be difficult. We all come from different backgrounds, and many may feel that, a lot of the times they feel like one is better than somebody else, and it could be difficult. I think the best thing to do when faced with these issues is to sit down with the staff and explain to them that the main goal of this facility is to give care and provide care to our patients. We do work in a pediatric environment, so it is important that all staff gets along. We don't have any bickering. We need to set a good and positive example for our patients. It is not healthy to have many disagreements, or it's okay to have disagreements, but to have altercations, because the best thing is for our patients to feel comfortable when they come to our environment. We don't want our patients to feel like they're walking on eggshells as they're walking in, or for them to feel the tension. A lot of the times, disagreement between staff members can cause or react in a negative matter to the patient. We might not give them the best care possible because we're too busy thinking or doing other things that might create conflict or harm to the patient.